I'm speaking with Hope, and I'm going to give 2/3 of my speed date to Hope. So I just want to touch on a couple of things. So this event is clearly not what some of our medical colleagues thought of. It's not about colons and the contents of colons. That was a popular belief. I want to touch on two things that came up at the UCL Education Conference yesterday. So the first one was about decolonising, so this is really on the button, but I hope it's not trendy for trendy's sake. I hope it's going to come out with some really valuable pedagogies. So decolonising is really about flattening power hierarchies and about, most importantly to us as medical educators, equipping future doctors to look after diverse populations, to be able to challenge power hierarchies, and this very much mirrors what we're seeing within medicine, not just medical education, so the decline of paternalism. The second thing was about co-creating and co-curating with students. So this is very, very topical again. And here we are in a student-faculty co-led project. So I hope that it's going to be very valuable and lead to some good outcomes. What we're essentially trying to do in medical education is to produce and breed kind, compassionate, socially literate doctors for the future. So these kind of events are really towards that. So I'm going to hand on to Hope.
I'm going to talk about a research project that we did in the past year-ish. So this was a curriculum mapping project. What we did was to look through every session taught in the clinical side of the curriculum. Students will know this as clinical and professional practice, and just group the sessions into themes. So these themes were things like gender, sexuality. We also had things like challenging power hierarchies and human rights. So it's quite a range. There are 12 of them, and this figure is probably like the main summary of everything, where each of the spokes on the circle represent one of the themes, and the distance from the center represents is proportional to the number of sessions that cover the themes. So you'll see a big loop round to the bottom left of the figure. That means that there were lots and lots of sessions covering that topic, which was patient experience. So what we found was that overall the curriculum does cover everything, which is encouraging. And overall the theme of patient experience, I think you can see from here, is quite well covered. So one of the things that we can take from this is that year 1 and 2 students, which is the preclinical students, get quite a good theoretical grounding. Or at least that's what we can infer from this. Clinical students is a bit harder to tell because a lot of teaching goes on informally in the wards and their placements, so it may not necessarily be as well represented here in this figure. So one of the difficulties doing this was that we were kind of defining our own boundaries as we went, because these kind of themes haven't really been defined in other publications. And while this knowing that the curriculum is quite comprehensive is encouraging, doesn't really tell us how the sessions were taught, and I'm going to speed through the rest of this. So we need faculty who have not just medical or sociological experience, but who have lived experience, who have worked directly with people from marginalized groups, so that students get a first-hand account of what it's like to live with these conditions, not just like a rose-tinted or a colored view of what all this is. Yep, that's all I have to say.